Hi there, you're welcome to Dami RX Care channel. My name is Dami Adamson, and you're welcome to our channel where we talk about medications and how to use them properly.
So our medication today is going to be Doxycycline, and a brand name of Doxycycline is also known as Vibramycin or Dorix. All right, so Doxycycline comes in tablet, capsule, syrup or solution or suspension, as well as injection. And doxycycline is usually comes in a 100 milligram dose and is usually taken every 12 hours, depending on what treatment that the patient is using it for. So doxycycline is normally used for different conditions such as acne, gonorrhea, syphilis, cervical or rectal infection, as well as prevention of malaria. So doxycycline works by stopping the growth of the bacteria and kind of helping reduce the symptoms that the patient is having because of that infection. All right, so what are some of the side effects of doxycycline? So some adverse effects include nausea, vomiting, and diarrhea, which is usually common with different antibiotics. All right, so usually patients may also have some dizziness, and a common long-term side effect of doxycycline is tooth discoloration, or it can stunt tooth and bone growth. Also, another common side effect for doxycycline when it's taken long-term is tongue darkening. So it can darken your tongue as well as cause some stomach cramps or burning, as well as increase your skin sensitivity to sunlight. All right, so what are some of the tips that you need to know about doxycycline while you're taking it? So it's preferably taken on an empty stomach, and you want to take it 1 hour before your meals, or if you're going to take it after your meals, 2 hours after your meals. And you want to take it with a full glass of water, which is about 240 ml. All right, you want to take this medication if you do have some side effects such as nausea, vomiting, and diarrhea with food or milk to kind of avoid any stomach upset or stomach cramping that may occur from taking doxycycline. Also, doxycycline can cause irritation of your throat, so you probably want to take the medication and not lay down within a couple of hours of taking that medication. Also, if it is a suspension, you want to make sure you shake the suspension very well before using the suspension, and make sure that while you're on this medication, you're avoiding unnecessary sunlight in order to avoid any sunburn. All right, doxycycline is usually not prescribed in patients who are less than 8 years old because, as I said earlier, it can stunt bone growth, and also it can cause some tooth discoloration as well. So it's usually not recommended in children less than 8 years old, and also patients who are pregnant. All right, excessive doxycycline use can cause C. diff, which is also known as Clostridium difficile, which is a condition whereby the patient is having persistent diarrhea that might be contagious in other patients that are come in contact with the patient's feces. All right. And also with doxycycline, when you're taking this medication, you want to make sure you're avoiding taking multivitamin that do contain calcium, magnesium, aluminum, iron, or zinc within a couple of hours of taking the medication, because these can decrease the doxycycline effectiveness in decreasing the bacterial growth. All right. And also when you're taking doxycycline, if you notice any persistent diarrhea, you want to make sure that you report to your doctor so they can test to make sure that this is just a light side effect of the medication and not a severe side effect like the C. diff that I mentioned earlier. All right, I hope these tips were able to help you in terms of what to look forward to while taking doxycycline. And make sure you like and subscribe to our channel in order to get more alerts when we post other educating contents. All right, we look forward to seeing more of you, and stay blessed.